is me Gayatri Akhil and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today I would like to discuss with you all about 15th of April 2022 OET exam, in which I am going to detail explain about OET writing. So what was the case note? It was an unknown case letter. So writing a letter to the rehabilitation center for the transitional care of the patient. Okay, so what is the patient name? The patient name was Ted Jameson. He is 84 years old male person and he got admitted in the hospital. So what is the reason for the admission? The patient got admitted in the hospital due to fall. The patient had a fall at home while he was doing a gardening, and because of that fall he just fractured his ankle and he got admitted in the hospital. There he undergone for an x-ray and the x-ray confirmed the fracture of the patient. After that, patient has knee braced and the affected part of the knee ankle was supported with the brace and he was immobilized for 6 weeks. And later on, the patient was applied with the affected part was treated with the ice packs and also analgesics and omeprazole for the gastric problem. So the patient was treated with analgesics and omeprazole. And patient was showing some improvements in his condition because he started to mobilize with the help of pickup frame. Thereby, the hospital was discharged the patient. And why the patient needs rehabilitation care, which means a patient is living on their own in this 3-story house. Though he has a sister who is assisting him in cooking only weekly once that she is coming to assist him. And also patient is having ischemic heart disease and patient is finding difficulties in mobility. Apart from that, patient is a smoker. He smokes almost 20 to 35 cigarettes in a day, and also he is an occasional drinker because he drinks weekly. And now we are writing this letter to the rehabilitative center because the patient needs medication monitoring and also patient needs more encouragements to mobile, and also patient has to change from pickup frame to walking stick. Most importantly, patient needs complete assistance with activities of daily living, and also he needs to be observed for risk of fall because he has a high risk of fall. And the other thing is like patient has some interest in reading books and watching soccer and also gardening. And apart from that, patient has an outpatient appointment also. So thereby someone has to be accompanied with the patient when the patient is going to the outpatient department fracture clinic. Okay, so these are the overall history about the patient. Now, how we can write this letter? Okay, so as I said, patient name is Mr. Ted Jameson and he is 84 years old. So what is his diagnosis, which means it is a lateral malleolus left ankle fracture. So we are going to make an introduction. In that, first, before we are writing the letter, we need to write a date on the top of the paper. So they have given the today's date as 7th of January 2023. And also patient is getting discharged on 7th of January 2023. Patient got admitted on 2nd of January 2023. So when the admission time, patient was having multiple complaints. Okay, so now first, as usual, to write a letter, first we have to write the date. So that date has given in the letter in the case note, which is today's date. Next, you are writing the addressing person address, because who is receiving your patient, that person's address has to be written on the top of the paper next to the date. And then salutation, because we are giving an introduction to the receiver of the letter. Then writing the patient name in the reference column. So we are writing the patient name as Mr. Ted Jameson. And what is his age? 84 years old. Now coming to the point of introduction. To make an introduction, you need 3 things: patient full name, purpose, and then diagnosis of the patient. So we can write in a multiple way. So each person might be written in a different way during your exam time. So we can write these points as a purpose. Okay, so let's move on to the introduction, how we can write an introduction. Mr. Ted Watson, who is recovering from a left ankle fracture, he requires your rehabilitative care and management. This is one way of writing. The second way, I'm writing to introduce Mr. Ted Watson, who is recovering from a left ankle fracture. He requires your medication monitoring and encouragement in mobility. This is also another way of writing. So if you want to write in a different way, which means you can write Mr. Ted Watson, who is recovering from left ankle fracture. He requires your transitional care and management after being discharged today. So likewise also you can written. So choice is yours, but the main thing is our purpose and also patient condition, patient full name. So the purpose is carrying a more mark in our introduction. So the purpose has to be accurate, not like further management and care and management. No, here we are sending the patient, discharging the patient into the rehabilitative center, right? So the rehabilitation, which means what? They are helping the helping the patient to bring back their normal life, physically, mentally, and everything. So the patient needs a complete transition, because if a patient is getting discharged from the hospital and going to the rehabilitation center before he reach home, so that he has to have a complete transitional care or rehabilitative care, or else the specific thing here they're highlighting in the recommendation, they are highlighted medication monitoring. Mobility is the main important thing, because he is having the high risk of fall. At the same time also he has impaired mobility because of the fracture. So these things are main important points that they have given in a recommendation paragraph, so these points can be highlighted in your purpose. Okay, so these are the different way of writing an introduction for this letter. Now coming to the point of present medical history paragraph. So present medical history paragraph is explaining about from the date of admission to date of discharge, what was happened to the patient, and then how we have treated the patient, how the patient showed the improvement in their condition, and when the patient got discharged. So let's move on to the present medical history paragraph, which comes under the introduction. Okay, now Mr. Jameson, because from the present medical history paragraph we have to use the surname of the patient. So Mr. Jameson was admitted on 2nd January 2023 with a complaints of left foot pain, ankle swelling, confusion, disorientation, and a bruisiness on forehead following a fall at home. Now, therefore, an X-ray has done, and which was confirmed the above mentioned diagnosis, because the diagnosis has written already a left ankle fracture, and then you can write it there, confirm the diagnosis. Therefore, he was immobilized with a brace for 6 days, and then applied ice packs on the affected part of the part. Then next we are just writing more. In addition, he has been commenced on Brufen 10 mg and also omeprazole 20 mg. So Brufen for the pain and anti-inflammatory, as well as omeprazole for like gastric things. And patient started to, fortunately, as a result of that, you can write any of the things. Patient started to mobilize by pickup frame and showed good progress in his condition. Therefore, he is being discharged on 7th of January 2023. So these are the present medical history paragraphs. So start with the admission date, compliance, and then what is the diagnostic procedure you have done to confirm the diagnosis. After confirm the diagnosis, what is the medical treatment or conservative management? For example, medication, physiotherapy, patient started to mobilize, and patient is getting discharged, because these are the good sign of mobility is a good sign of recovery, isn't it? Now we have to know the social background of the patient, because we are completely discharging the patient from the hospital to the rehabilitative center. So the rehabilitative center who is receiving the patient, they must know about the background of the patient, isn't it? So the third paragraph we are going to write the social background paragraph. So we can start like socially. Mr. Jason is a retired engineer, and then he is and lives on own in 3-story house. Though he has a sister who visits him weekly to assist him in household chores, like that also, or cooking, you can write the specific things. He has a history of ischemic heart disease, and he smokes how many cigarettes, like almost 10 to 25 cigarettes in a day, and drinks weekly. So these are the important informations that rehabilitative center person has to know about the patient before they are receiving the patient. Okay, and apart from that, patient has interest in gardening, reading books, and also patient has interest to watch soccer. Okay, so these are the social background which we have to written in our social background history of the patient. Now the last one is very important paragraph, which is the recommendation paragraph. What they have to do for our patient once they receive the patient, what they have to do. So we can start the passage like, in view of the above, kindly encourage Mr. Jason to walk with a stick rather than pick up frame. This is the first one. Third one, most importantly, monitor his medication compliance. Third one, it is a good idea to encourage him to, it is a good idea to assess him. It is a good idea to assist him with activities of daily living, and also monitor for risk of fall, because he is having the high risk of fall. So that thing we can mention it. Then please note that, because we are giving them one more humble request is, please note that patient has an appointment, outpatient appointment on 21st of January in the fracture clinic, and he has to be accompanied by one person. So this is very important thing that they have to be written it. So these all are the recommendation paragraph. One is medication monitoring. Second, encourage him to use walking stick rather than pick up frame. And third thing is, please assist him in activities of daily living as he has a high risk of fall. And the fourth thing, someone has to be accompanied with the patient when he has an appointment in outpatient department on 21st of January. And apart from this, as patient is reluctant to go to the rehabilitative center, but eventually he is agreed to get the care from rehabilitative center. So that is an important thing that we have to mention, because as patient was reluctant to go initially, but eventually the patient was okay with that. Okay, so this is the letter which they have asked 15th of April 2023 exam. I hope that you all have done in a very good way, and whomever is preparing for your upcoming exam, we have a mock batch and also writing and speaking classes also running in online. So whomever wants to participate in our class or join in our class, you can contact us at any time. Our number has given in our description. Okay, so apart from that, we have a beginners batch, 40 days, 60 days, 50 days classes also going on. So 10 days, 20 days. So only you want to concentrate on your writing, so that class is also there, and for speaking also. Or if you want to go for your 4 modules, or if you want to go for only 2 modules, so this all the classes are running. So whomever wants to join in our class, you can contact us at any time. Our number has given in our description. Okay, so until then, bye bye and happy wish you to you all.